go. Now, I'm going to have you turn your head this way. I'm going to show the people at home. If you look at an ear as an upside down fetus, this is a microcosm of the body. And so the way your body is wired, your nervous system is wired, is you can look at an ear as an upside down fetus. So the head is here. The spine is here. So we got the neck right here. We got the shoulder here, the low back here. The woman's uterus is right in the middle of the fossa, the triangle fossa right here. The heart and lungs are down in here. Thyroid and mouth are right there. Kidney, bladder, bowel, all up in this little cave up in here. All that can be proven. All of it can be shown with little stimulator. You can spark function in those areas. It's incredible. Yeah, it's incredible. So, how are you feeling?
Good.
Good. All right. Again, digestive stuff with you. So we're going to do a couple similar points here. There's different forms of acupuncture. Acupuncture was born from Chinese medicine.
Okay.
But of course, there's a Korean style, there's Japanese style, there's French Vietnamese style, there's Wesleyan, which is English. So it's a 5-element. I use different methods. When we go through school, we learn TCM, which is traditional Chinese medicine. When people we joke, when you become a real acupuncturist, you don't do TCM anymore. You do Tan style, balance method. You do Dung style. There's different family lineage styles of acupuncture and so I do a blended style.
Okay.
And so I mix in, this is called auricular acupuncture, the ear acupuncture, the kind that you didn't want. and so when you're treating, you're of course treating that person. You're not treating a label. I'm treating GERD. No, I'm treating Bill.
Yeah.
And so I have to figure out what works for Bill, because Bill might not respond all that great to auricular acupuncture, but maybe he responds great to Dung style. I might do 3 needles. He's like, wow, it's gone. Now, conditions like insomnia, things that you can't just correct. Well, can you sleep now? I can't get that immediate read. If somebody comes in pain and they leave without it, doesn't mean they're cured, but it means I'm on the right track.
Okay.
And so I want to send that message to the nervous system and get that patient going. So I remember I said acupuncture works on different levels. There's different styles of acupuncture, and there's different patients, and so you have to have it all come together. Here I use a bunch of different oils for the sake of the show. I'm going to do some simple thing here. I have a formula, and the formula has lavender and eucalyptus and a couple other. It's balanced in a stimulating sense and in a calming sense. So it's a real nice formula. But then I also, as I said to you before, I have petitgrain, and petitgrain is used for stress relief. I use it for patients who tend to hold on to anger, frustration, resentment, which tends to be about 78% of all Americans. And so what I'm going to do is the oils have a frequency, and so in a sense I can stimulate an acupuncture point, which again is a point of lower electrical resistance, which just means I can access your electrical energy more readily. So whether I do it with an oil or with sound, which I'm going to show you shortly, with stainless steel, there's a bunch of different things you can do, right? I can do it with my voice. Relaxing?
Just a little bit, yeah.
Okay. I was going to say I kind of felt you drifting off here. I was impressed by myself. All right. So what I'm going to have you do is take a nice deep whiff here. By involving, wow, that is nice. By pulling in the olfactory, by smelling, what you're doing is we're activating the limbic system or the amygdala, and so it's where the seat of emotions are, and so it's the basal part of the brain. And so by activating that, I can have a stronger effect in a relaxation protocol. And so, again, like that?
Yeah, I do.
Good. All right, so next. All right, now, and we're going to use this on the tops of your shoulders because that just seemed very, very tight up here. Gallbladder 20 activates the sympathetic nervous system. Gallbladder 21 right below it. Yeah, these are great points to help alleviate stress. So if people, so for you at home, base of the skull about 1.5 inches out from the cervical spine, the neck bones. If you go out just the base of the skull and you rub that, and then you rub the top of the shoulder, push down, rub the top of the shoulder, little essential oil, and then smell it, really does the trick. These are tuning forks. These are weighted tuning forks, and I have a low frequency and I have a medium frequency here. Low frequency, I could use this. If say Erica had a stress fracture, I could find out if she had a stress fracture. I can treat bone issues, but I like to mix it in with the medium frequency, which is great for tissue issues. Pardon the rhyme. Okay, but I also use these for entrainment. So when I treat veterans, when I do this kind of community style, what you'll see. Now, speaking loudly so everybody can hear you, what is that like?
It's like a vibration.
Okay, so what would be happening here is if we were in a setting where they didn't have cameras on them, usually the light's kind of, a little bit muted, or it's a calmer setting anyways. What happens is I have people take deep breaths, and this is entrainment. And so entrainment, when you have different frequencies on either side, the right and left brain try to make it the same frequency. So it's hard to think of something else. So when you did that, didn't you kind of just zero in and go like this? Yeah. And so it's really fun. So you mix that in with the oil and the acupuncture, and it's like me getting a really strong hold on the nervous system and really calming that down. So right now, versus when you came in here, your body's using far less energy.
Okay.
So do you feel more relaxed?
I do.
Yeah. All right, ready? Now, of course, I would be doing this for a few minutes with you, and we just, for the sake of TV,
Right.
not going to happen. But I just wanted each of you to experience it. A lot of times with the kind of acupuncture I do, like say that you had a left knee issue, I might treat the right elbow. I oftentimes don't touch the area that's problematic.
Yeah.
So
I could feel it, I just couldn't hear it.
you couldn't hear it?
No. But I could feel it.
Okay, let's try it again. So
That I can hear now.
So one of the things that I would be addressing with your sister is hearing issue. Yeah, because I'm going to show you what I just did to her, but I'm going to hold it out. You tell me when you can hear it.
I can hear it.
Mm-hmm. And I did. And now watch. This is how hard that I hit it for her, and this is how close I was. Yeah. So that's like having this. That's like having the headphones way up, and you. Now I can hear it.
I could hear it the second time, but only briefly.
Okay. Yeah. There's some.
Yes.
Yeah. Yeah. So we'll have to talk about that.
I could feel the vibration though, more than I could hear it. But I could feel it.
Interesting. I mean, I think that can you feel the sound? Can you feel any vibration?
I feel it in my head.
Yeah. And so the again, sound therapy. There's just a quick look at it. We got to get to the next segment. So thanks for checking this out. What we're going to do is I'm going to be right back. And Aaron and I will be in a different setting, and I'll be showing you kind of a private treatment. I'll show you cupping and gua sha, so let's get to it.